Oh, it's so dark. Can't even see. Hi, everyone. Anyways, so we are 1 day away from Genesis's CPAM surgery. For those of you that don't know, she during my 20 weeks utero, doctors found out, or like the radiologist found out that she had a CPAM. It's called congenital pulmonary airway malformation in her lung. We've actually been waiting so many times to do the surgery. Here we are the day before the surgery. She was supposed to do it May, June, July, but for some reason she got sick. She caught some ear infection, respiratory or viral infection in her upper respiratory area. And then August came. The lung specialist that needs to be there during the surgery is not available. So here we are, September, and she has a runny nose. I am just waiting for the doctor's call to see if it's a go or a cancellation again. But because it's a risky surgery and it has to do with the lungs, the doctors usually reschedule the surgery because they don't want to put her through any more stress than her body needs to. And look at baby Genesis. She's like anxious to go somewhere. Hi, Genesis. Say hi. What are you doing? You took mommy's keys. Let me make a video and then we're gonna go, okay? And anyways, so what CPAM is a non-functional lesion in her lung. It's about 4 centimeters. It stopped growing about 2 months after birth, but they want to remove it just because it has a cluster of macro and micro cysts, which is big and small cysts in our term, English term, not medical term, but it's a cluster of a lot of cysts in that lesion, and it's not doing anything, but they just want to make sure that it doesn't turn into cancer later on down the road. So what they want to do is they want to make sure during the surgery they're going to remove that part of the lobe that has the cyst in, and as much extra part of the lung that has it, so it doesn't become cancer or doesn't spread later on down the road. And then when everything goes good, by the time she's 8, she should have almost a full lung again and a lot healthier. Today's been really quite a hard day because since the morning time, my husband, come here, Genesis, come here. He decided last minute that he didn't want to go through with the surgery, and it just confused me, and we just got into a big argument about it. And he told me to do my research, and I did do my research, and a lot of it does match up to what the doctors are saying. And then I also got a second opinion with Children's Hospital, and they said the same thing. So here we are right now. When the surgeon calls, I'm going to have him call my husband. And any questions that my husband has, I'm going to have him address it to my husband, because I don't know. I couldn't answer any of his questions and concerns. And it's just making us argue, because I'm like, why wait the day of when we had months to plan, months to make a decision whether or not we're going to do it. And one thing I learned about what I did my research on, and maybe I can put references back to it and you can see for yourself. But what I looked at is I looked at a lot of the data where they did a study. Why do I have to surgically remove it if it's not causing any symptoms? I forgot what's the word for it. Asystematic or something like that. There's no symptoms, so why do the baby have to, or why do they have to remove it if it's not doing anything? For one, I know they don't want it to become cancer down the road and then spread to all her other healthier lungs. So that's why usually by the time they're 1, they want to have it removed. That way it's more, more effective having the surgery, and then she'll be a lot healthier and almost have a full capacity of lung by the time she's 8. That's based on what I've read and researched. Now, as far as Genesis going through it, I'll try as much as I can to keep videos post-dated of any symptoms or anything she has after the surgery. Hopefully none. Hopefully none. Hopefully, I did see like a lot of videos on YouTube of little kids that have similar situation, but then I haven't seen no update as far as like they're how old right now and how they're doing. But I did know that my perinatal doctor said that because those of you that don't know, this Genesis is my number 7, and she said, and I wanted to tie my tubes after I gave birth, and she said, I usually don't want to advise you, but because you have a lot of kids, and I have an autistic child, which is my number 6, this baby Genesis is gonna have to be going to a lot of doctor's appointment even after her surgery. This is like a lifetime thing. So as far as the extreme of how often she has to go to the doctors, I'm not sure. I did do a research on one research that I came across, and it did say once every so often, like 3 years or so, something like that. But yeah, I'm not really too sure, but I know it's like years, like every year or every 3 years that they come see the kid and anything. Or of course, if they develop symptoms that you're concerned about, you can always call the doctor. But anyways, so yeah, her surgery is tomorrow. Today's September 12th, so her surgery is tomorrow, Wednesday, at 6:30 in the morning. I'm like really bummed out. For days I've been trying to get the house in order with a lot of kids. You just don't want to go to the hospital, like not having your house in order, because you're going to be over there. My main focus is going to be on her no matter what. It's going to be on her, so I packed up to stay for a few days or however long it takes for her to recover and get healthy. But yeah, I've been doing a lot of praying. I've been listening to praise and worship songs, just cleaning the house, and with Gabriel, sometimes him and my husband, they clash a lot, and he like tends to look for me more than my husband. So let me call you back. Oh. Hello?
Is this Rosalind, the mother of Genesis?
This is she, yes.
Hi, this is Dr. I don't have your daughter's last name with me, so
Bagwell.
This is Dr. Gilbert, the anesthesiologist for tomorrow.
Uh-huh.
And Dr. Vasquez was just talking to me about your daughter having a runny nose and all that, so he wanted me to give you a buzz. So I guess you've had her delayed several times before for colds and flus and stuff.
Yeah, since May, like we postponed it because she had a cold, and then June, I think, ear infection, and then July a cold again, and then August, I don't remember if she had anything, but here we are, September, she's coming up with a runny nose again. So like it's clear, there's no fever, no cough. Yeah. Okay, because what was I gonna say? I was like willing to drive anywhere so you guys can check her out today just to make sure. You're there till 4:30? Okay. Okay, what is your name again? Doctor. And you're the anesthesiologist? Yes, yes. So, just on the first floor? Okay. Maybe around like, are you going back to work, Glenn? Oh, no. I was asking my husband. So maybe like 3 o'clock. Is that okay? Okay. Okay. Go ahead. I have it. Okay. Okay. Oh. Okay. Again, 858. 4658. Okay. Okay then. We'll see you then. Okay. All right. Thank you. Bye. You, Dr. Vasquez didn't call you? Like a private number? He's supposed to just call you like not too long ago. He said I gave him your number and he's oh no, he looked at the system and said dad's number is 64992. I said yeah. He said okay, I'll give him a call. This is the anesthesiologist.
And what did he say?
I said my husband had some questions and concerns he wanted to ask and I don't have answers for him, so can you give him a buzz and like see like if he can answer the questions for him.
Hoping for the best, Jason. Jason, anything wrong?